Who hasn't heard of the AARP? With over 37 million members, the national nonprofit is the advocate and the voice of the aged. Touching every issue from Social Security to the cost of health care, AARP's reach and clout are felt everywhere that aging policy is discussed, and its views help shape the debate on how our nation allocates attention and resources between young and old. AARP's national president is Jeannine English. She joins me next on Studio Sacramento.
At Five Star Bank, community is at the heart of what we do. Every day we strive to have thoughtful solutions for our customers and help our communities prosper. Honest dialogue about the issues affecting the region is vitally important to that prosperity. We are proud to be part of the conversation and hope you'll join in.
AARP and Social Security are almost thought of as synonymous. What is it about Social Security that makes it so central to AARP's advocacy and mission?
Well, Social Security is really the greatest program we've ever had. It's been around 80 years. And before Social Security, when you became old, you became poor. And what we did is we made a promise, and the promise was that there would be a mechanism so that people could live with dignity as they got older. And that's why it's so important to us. It's consistent with our mission to live with dignity and purpose as you age.
And Social Security today, as it's a multiplicity of programs, everything from basic income support to the provision of medical care and disability. Mm-hmm. Among those, what is AARP's primary focus?
Well, of course, our primary focus is the Social Security benefit for older adults, but we also believe that the Social Security disability is so important. Many people just can't continue to work, and they need to have that option, and they may not be at retirement age. So we support both of those programs and think that they're both very important and crucial, and that's why we really focused this last year on the 80th anniversary of that great program.
And incidentally, how many Americans in one form or another rely on the Social Security system on a daily basis?
Well, you know, basically, I don't have that total number for you, but I can just tell you that many people have to rely on it when they're at early retirement age at 62. There's only 5% of people that wait until they're 70 because in many cases they just can't wait. They don't have that option. We at AARP would like most people to be able to wait till they're 70. It's a better opportunity to make sure that you have the resources when you're older. You get about 130% of the benefit if you wait till you're 70. You only get 80% if you take the benefit at 62. So it's a huge difference, but many people just can't. They can't work for those longer years.
Well, some people opting into the system earlier may be worried that if they don't get in now, the system may not be there for them. Studies have stated that the trust fund may start to go backwards where it can't pay full benefits in 2035. The disability part of Social Security potentially hits a crisis point next year. What is the reason that we can't seem to come up with a permanent solution on how to make sure that the benefit is in place for the generations yet to come?
Well, I think we do know that the benefit is. The benefit will be there until 2034. And in 2034, all that happens is that there's less money coming in than going out. And the reason for that is that we have 10,000 people turning 65 every day. I mean, if you look at demographics, you see that the big growth are those people over 80. And when you have that many people
It's not the baby boomers.
Well, the baby boomers are getting older, and as they get older, those people over 80 are going to get bigger and bigger. You can see that in the future. So what we need to do is we need to, make some minor adjustments to Social Security. Every program no matter how wonderful it is, needs to be adjusted to the demographics. And that's one of the things that we are doing at AARP. We've started a campaign called Take a Stand, where we're asking all of the presidential candidates to tell us what their plan is to make Social Security solvent for our children and our grandchildren. And let me say that the people getting Social Security now, or close to Social Security now, or getting it in the next 10, 20 years, they're fine. The Social Security benefit is there. The problem is that we need to look at the current delivery system. And one aspect that AARP has always advocated for and continues to is lifting the cap. You know, only certain income actually pays into Social Security. It's only up to $118,000. Right.
Kind of like, yeah. And so what happens is that how far up do you think that cap should be lifted?
Well, I think that's a question that we need to talk to the candidates and the politicians about. Because there are other adjustments that can be made. We need to make sure that there's adequate benefit for people so that they're not impoverished.
Let's go back to your Take a Stand campaign. What are you looking for these candidates for president, regardless of affiliation? What are you looking for them to say?
To understand how important Social Security is and recognize that we need to make sure that it's there for our children and our grandchildren, and in doing so, there are some minor adjustments.
Is there a litmus test that, for instance, I know that you all don't necessarily endorse candidates.
We don't ever. Right.
But is there a litmus test in terms of what you're looking for in terms of deciding whether someone's friendly towards Social Security or not?
Well, I wouldn't say that, but I would say that there are a lot of different opportunities for adjusting the program that we've looked at, and we would like to see what some of those proposals are, and then we will, evaluate all of those proposals.
Well, one perennial adjustment that some have suggested for the program is to privatize it. That was a big push by the second Bush administration. And I'm curious, what would have happened if that particular approach had taken place?
Well, we think it would have been devastating. We've always been
Really?
opposed to privatizing. First of all, you need to make sure that you reduce or take out the risk. Because one thing that happens when you're older is you can't go back and make up the money you've lost. You have to make sure that that nest egg is there forever. Because people in their 50s, if they lose their job, they have a 9% chance of finding a job. And if you're in your 60s, you have a 6% chance of finding a job. So when you look at that and you realize people can't make it up, if they lose that nest egg, they're bankrupt and they're impoverished. And that's the concern.
Argument, though, is that as catastrophic as the crash was, that if people had their money in an indexed account, the crash would have happened, they would have lost 60, 80% of their value, but the market has bounced back and then some, and that they would have done just fine.
What happens to the 90-year-old? What happens to the 90-year-old that can't wait for that bounce back? And what happens to the 85-year-old that maybe is only going to live another year? How can you wait for that bounce back? You just can't. And we're talking about people that Social Security is a huge, huge part of their income. And it's not a lot. When you look at the average income from Social Security, for average, it's about $15,000 a year. $15,000. Now for women, it's about $12,000. And when that's a big portion of your family income, there's no way to bounce back. Some people can have a little bump in the road and then they can recover. But if you don't have savings and you don't have a job, those bumps in the road are just devastating.
Well, interesting, you talk about the 80 or 90-year-old. One of the other emerging issues is about longevity and how it's tied to this great national debate on income inequality. And that as people are living longer into their 80s and 90s, we're seeing a bit of a disconnect. No one's quite figured out what's the reality of it, but it tends to be that people of higher socioeconomic groups and better educations are living longer, and that other folks who come from the lower echelons of society, who also pay into Social Security, are living shorter lives. And so therefore, the benefits are becoming a little bit skewed. Is AARP looking at that issue at all?
Sure, and we are, and we're very concerned about it. And one of the things that I can tell you is when we talk about increasing the retirement age, last time that was done, where Social Security retirement age was increased, people of color lost out by about 2 years. It had a huge impact in their total payment because they're not living longer. Particularly African American and Hispanic Latinos lose significantly from this idea of longevity. So we have to really protect everyone in Social Security and make sure that that promise is there for all. And that's why you can't just decide that you're going to, do across-the-board cuts or do any of these across-the-board increases in retirement. It doesn't work that way.
What do you see as the greatest threat to the Social Security system and the security that it brings people today?
Well, I think Social Security will be there forever. I think it's supported by people. It's a very popular program. I think it will be there. So I don't think there's a great threat. I think the issue is, I think our political system, our politicians need to deal with it earlier, not later, because people need to be able to count on it. It needs to be there, and they need to know that it's going to be there for their children and their grandchildren.
And other than the issue of ensuring the basic benefit is there for people, what are some of the other big issues that AARP is working on today?
So, of course, we're working on more than just Social Security. It was always supposed to be part of a kind of a three-pronged stool. It was supposed to be the pension, and pensions are vanishing, unfortunately, and savings. So one of the things we're really working on is to help set up throughout the states savings programs that allow people to automatically get into a savings program.
Automatically?
So when you're in a small or middle-sized business, similar to many big companies, you would not have to opt in. You would be put in a savings program immediately. And what we find is 85% of people stay in those programs. But if you have to opt in, only 15% opt in. So we want to make it easy for people to save. And actually, throughout the states, we're working on legislation to set up those types of programs that make it easy for small and medium-sized business to
take the place of the historic traditional pension programs that big companies used to offer.
Well, it won't really take the place, but it'll set up an easy way for them to save 5, 10, 15% of their own income. And if an employer wants to match it, great.
So much the better.
Yeah,
so much the better.
Exactly.
You're raising, though, a really important issue in that when we look at the last decade or so, and you look at how much wealth was destroyed for individuals and families throughout the country, and you talked about the bounce back for the 80 or 90-year-old, there are a lot of working families, or want to be working families in this country, who haven't bounced back from the recession, who are in their 30s, 40s, and 50s, maybe even 60s. Mm-hmm. And because of the lack of income gains and also the destruction of the wealth that happened in the recession, there's a fear and a concern that we have a whole class or generation of people who are going to be working virtually until they drop, to be a bit dramatic mm-hmm. about it. Mm-hmm. Is that something that your members are communicating to you all about?
Well, absolutely. I mean, it's kind of a two-pronged issue. One is that there are a lot of people that want to work into their 60s, 70s, even 80s, and they're discriminated against. And so we have really been focused on age discrimination and changing the standard. The standard to show age discrimination is a far higher bar than any other types of discrimination. And we're trying to to change that.
That's on an optionality standpoint that someone wants to work.
That's right.
But for those who have no choice because of the erosion of their life savings
Right.
or their family wealth, they lost their home during the recession because of employment or some other dislocation. What about that issue?
Well, it's a huge issue, and that's why we also want to make sure that there are programs so that people can be retooled, so that they can get into new types of industries as they get older, so they're not, they may not have to be doing the heavy lifting that they were doing at some point. So providing that kind of flexibility for individuals as they get older. But also, we have to recognize that Social Security is the guardian angel, really, for those folks that can't work and need to continue to have some.
It sounds like that the definition of aging and sort of aged America is somewhat shifting and changing. Who are we as a society evolving into? How are the aged different today than they may were 25, 30 years ago?
Well, I think that we have a better understanding of the fact that if you have health and if you have the ability to do different things, that you are not limited just by your age, and that that has changed. You're not going to be sitting in a rocking chair and you're not done. And I think that's what we find with baby boomers. They don't want to be done. They want to go on to the next thing. And what their what's next is can be a new passion, it could be a new job, it can be whatever they want. So we at AARP try to provide opportunities and tools and change laws and change views about the aging process.
As the baby boomers continue to take up a bigger and bigger proportion of the aged population, they're going to be consuming increasing amounts of resources within the healthcare and support system in this country. One of the raps on AARP is that AARP's strength and power because, frankly, your members vote, and
Right.
they are very, very active.
Right.
They are essentially redirecting a lot of what could be investment capital, to use sort of a private sector market term, that should be deployed into the younger parts of society for the benefit of folks who, frankly, are not necessarily going to be creating and supporting the retirees of the future. How do you respond to that?
Well, I think the retirees of the future, are multifaceted, and they're not just, as I said, just sitting there. They're volunteering, they're engaged. One of the things that I think that we are thinking about, and we're doing a lot of work, is the fact that as people get older, there's more and more need for caregiving. And we know that the caregivers between 45 and 64 generally.
Who are they?
It's generally a woman between 45 and 64 that's caring for her mother, her father, or her spouse. And without that support from those individuals, we wouldn't have, it's really the backbone of the long-term care system, unfortunately. It's in this state, it's worth about $50 billion.
$50 billion.
In the United States, it's worth about $470 billion. That care is crucial, and so one of the things we're doing at AARP is we're really supporting the caregiver, and we're encouraging businesses to provide a lot more flexibility for the caregiver. We've had flexibility, not as enough, but we've had flexibility for the moms and the dads that are caring for their children, but there hasn't been a lot of flexibility for the caregiver, and people have had to leave their jobs and leave their own financial support system to care for their loved ones. So we're also working really hard on trying to provide more flexibility, more opportunities for respite for those caregivers.
It's interesting you mentioned that. We, a while back, did a show on caregivers that we did in conjunction with our, with Capital Public Radio here on caregiving and the stories of the families that were engaged in that. And they are exhausted. Mm-hmm. Mm-hmm. It does not appear that we as a society have much of a safety net to ensure that not just that the aged are taken care of, but that their loved ones who are caring for them have any sort of ongoing support system.
Exactly.
So do we have a whole sort from a statutory perspective that we haven't addressed with regards to family medical leave or those types of things that tend to be advanced either by law or by practice by employers to deal with caring for our aged?
We do have gaps. We do have serious gaps. We also have gaps. One of the things that we've been working on is an act called the CARE Act, which it requires hospitals to let the caregiver know that they're discharging someone. You'd think that that would be obvious, but it isn't always.
Really?
And would also train the caregiver on how to do medication management, wound management, that type of thing. Because we find that too many people get out of the hospital and then they have to go right back in the hospital because they're not adequately taken care of once they get home. So that is a gap, but there's also a whole gap in, our healthcare system. And one of the things that we are very supportive of, and the reason we supported the Affordable Care Act, are the accountable care organizations that are looking at people from a more patient-centered approach to make sure that you solve all the needs for that individual so that they can stay in their home. We know that 90% of people want to stay in their home, and most people die in a hospital. So that's there's a disconnect there.
Is that advocacy in that area related to also changing how it is that we put together communities, so that somehow we are more holistic in approach to the siting of services, the types of housing that are provided, things like that, where it is that you're really looking at keeping families and support services sort of in an intact ecosystem type of approach?
Exactly. One of the things we're working on is age-friendly communities. And I'm happy to say here in the Sacramento region, America Balden just joined West Sacramento into the age-friendly community
Tell us
network of
what is
AARP.
that exactly?
So it's not layering any new programs on, but it's really a way to look at developing your community, making changes to your community so that everyone can continue to stay in the community and live in the community. And it's how close hospitals are and medical facilities, and whether it's walkable, and whether people can connect in the community. If you want to stay in your home, to be able to stay in your home, you need to be able to walk outside and get across the street and not have to be an Olympic sprinter before that flashing light starts flashing and you have to run. And that's true for people with strollers, it's true for people with walkers. So recognizing that as you make changes to your community, you have to bring the community in to talk about the impact it is on the entire community, and that's all levels of aging. And that's why we think age-friendly communities are so important. The other thing that we're finding with baby boomers is they're not moving far out. They want to move into the cities, and that's a big change too. And so making sure that those cities and those communities are responsive to the needs of all ages.
Well, that makes me think of another reason to have communities that are more thoughtful in their design and approach, and that is that increasingly you have seniors taking care of, we talked a little bit about children taking care of their parents, but also grandparents and beyond taking care of their grandchildren.
Exactly.
And that in many cases, that while that may have been an anomaly years ago, is becoming far more prevalent, and that there are not a lot of support structures to help the aged when it is that they're taking care of the youngest among us.
Exactly. And one of the things that was really interesting when we looked at the whole issue of student debt last year and have been working on that, that's been something that AARP has been concerned with. That
Really? That's
high
a surprise.
student debt. Well, and one of the reasons for that is that it's second to mortgage debt for seniors.
For seniors?
For seniors. And part of that is that people go back to school, but a big part is that they're paying for their children and their grandchildren to go back to school.
That is really, really surprising. One would have never thought that student loans and student debt would be something that would affect seniors. So as you look ahead, what do you think will be, the uppermost issue for AARP in the coming months and years?
Well, I think that, of course, Social Security is right there and something that we really think that needs to happen sooner. As I mentioned before, we also are doing a lot of work on making sure that health care is fully implemented, and it should be something that everyone has access to, health care, and looking at these accountable care organizations that I mentioned before so that people are in the center of the care. They're not just walking in, getting 5 minutes with a physician and leaving and not knowing what happened to them. They're actually in the center of care, and that's what we advocate for.
And we'll leave it there.
Oh, thank you.
All right. And that's our show. Thanks to our guests and thanks to you for watching Studio Sacramento. I'm Scott Syphax. See you next time right here on KVIE.
At Five Star Bank, community is at the heart of what we do. Every day we strive to have thoughtful solutions for our customers and help our communities prosper. Honest dialogue about the issues affecting the region is vitally important to that prosperity. We are proud to be part of the conversation and hope you'll join in.
All episodes of Studio Sacramento, along with other KVIE programs, are available to watch online at kvie.org/video.